Hi, I'm Steve Huft. I'm an occupational therapist with Spooner Physical Therapy at our location in Scottsdale. As an occupational therapist, I specialize in treating the upper extremity, so everything from the shoulder girdle down to the fingertips. Today, I'd like to go over some shoulder exercises that you can complete at home if you've had shoulder surgery, specifically a rotator cuff repair or maybe a shoulder replacement. I'm going to have Brian Schulte, our fit trainer here at our Scottsdale location, demonstrate some exercises that you can complete at home. And afterwards, we'll talk about why it's important to do these exercises. So first, Brian's got his right arm here, just against his side, like imagine this is his sling, and he's just using the opposite arm, unaffected arm, to create the motion of the scapula here to get an anterior and a posterior glide. He's using his hips, he's using his spine, but keeping that arm tight against the side, not moving that surgically repaired side. And now we're getting good shoulder abduction and adduction. Again, Brian's using his hip, he's using his legs, he's using his spine, getting the glide of the scapula without moving it. Finally, Brian's doing some internal and external rotation, so getting that medial and lateral glide of the scapula to move by moving the other unaffected extremity. The reason why it's important to complete the exercise at home that we just had Brian demonstrate to us is a lot of times after shoulder surgery, when you're in this sling, so let's pretend that Brian's arm's in a sling, your shoulder might come forward, and what will happen is it'll put your tissues and joints in a tight protective position, which they should be, but sometimes that you can develop substitutional patterns when you're trying to perform regular motion. If you look at his unaffected arm, a lot of times you'll see it will move great. But somebody who's had surgery and is developing them substitutional patterns, other muscles will want to help out. And when you have this happen, it can lead to further post-surgical problems like a shoulder impingement, possible radiating neck pain. So if you perform these exercises at home, this is something that can prevent that from happening. For Steve and Brian, thank you for your time, and keep your health in motion.